Our decision to choose Nightingale out of all the EMR providers was actually a relatively easy decision. I had spoken to some other physicians, and Nightingale was always in the top.
When you'd complete your day, you'd have a pile of charts to review, you'd have all these lab results to review, and you'd have to do it in the office.
My day-to-day routine consisted of a busy general practice and seeing a lot of patients, and coming home at the end of the day with 3 or 4 box loads of paper charts that kept me up till 2 o'clock in the morning.
We wanted to improve the quality of our medical records in the office, and we wanted to improve the quality of of our daily life.
Nightingale to me seemed to be like the Cadillac of all EMRs. It's amazing how many lab results, consultant reports, diagnostic imaging gets lost or misfiled. Now this doesn't happen.
I can graph somebody's cholesterol for the last 3 years, and I can compare it, and I can say, look, here you're doing better, here you're doing worse. Whereas before, if you had it all on chart and paper, you'd have to go through the chart and find their last lab result.
Staff are not required to open all those laboratory mail envelopes, pull a chart to attach to the mail, put the chart on the doctor's desk, wait for the physician to decide what to do with that laboratory result, take the chart back, file it away. All those workflow processes have been eliminated.
I'm able to document a UTI, a bronchitis, a gastroenteritis with 5 tabs, where it used to take me about 10 to 15 minutes to write up an annual health exam. I'm able to do it within 3 minutes.
We can actually show the patient how their blood pressure is doing, how their diabetes is doing, how other parameters about their health are improving. And this is a big incentive for the patients to continue to follow the treatment protocols that we advise them to follow. We have a very good working relationship with Nightingale staff, and we feel that this is a long-term relationship.
They sent people who studied my workflow, made suggestions into how to alter that workflow.
Each doctor can use it differently to customize their practice.
I think Nightingale has an exceptional product, but I also believe that the support, the service after sale was truly outstanding with Nightingale. They're continually trying to improve their software over time, but most importantly, they support you along the transition process.
Very good training from the Nightingale support staff. We went to the Nightingale head office and we had hands-on learning experience.
It takes time, but it's interesting because once you do it and then you go back to charts, you realize how good it is to have it EMR. Now I have a 3-year-old at home, so sometimes she needs to be picked up at school at a certain time. So I can actually leave the office, because it's ASP based, I can actually leave the office, go do what I need to do with her, and then in the evening when she's asleep, then I get to my paperwork.
I'm able to access it from home. I don't have to carry a box of paper charts. But also when I go away on vacation, I'm able to keep an eye on my associate physicians, see what they're doing, check on patient lab results, review mammogram results.
Whether it's be home on time for my child's soccer game or hockey practice, or get home on time for dinner for a change.
After 30 years of practice without an EMR, I now am at home in the evening, on the weekends.
Not being in the office allows me to take care of other people in my life, to take care of myself, exercise more.
These things were not possible with paper records. Before, I used to have a stack of charts on my desk. I'd finish seeing my patients, but I still had all my paper notes to write and heavy charts to look at. That burden of paper is now gone.